Welcome back, folks. This is June the 24th, and we've got another load of questions that have come in, and I'm going to try to go through those as best we can. Um, as you'll notice, in the game of medicine, they call it a practice for a reason. It is practice, very few absolutes. So when you're looking for absolutes and guarantees, there are none in life. And the reality is that nobody's getting out of here alive, but I'm going to address some of these questions with that concept in mind. The first one we have here is from Bill. If Velasta and fenbendazole work, why doesn't it work all the time? It's just what I just previously stated. There are no absolutes. When it comes to medicine, every single person of the 7 billion that's on the earth all behave differently. They produce different concentrations of the hundreds of thousands of molecules they produce each and every day. There's variations in all of them. We're all different. We look at percentages and try to figure out statistically what seems to be working, and biochemically as close to the science as we can get as to why these things work, and try to understand that from a chemical point of view, we have a much better perspective as to the method of or the process of activity. So I'm not following the fenbendazole process at this point. My primary focus is in the Velasta. I understand it biochemically, why it works and how it works. I can't explain on the fenbendazole. Andre writes, does prostate cancer express enough DLP1? And I typed in, did you really mean PD-L1? Because there is a DP1 prostaglandins receptor also. But typically when we refer to Velasta, we refer to it as PD-L1, programmed death ligand 1. And that's the one that I have the most experience in. The PD-L1 receptor is a tyrosine N group, which means that it will react with the Astaxanthin that's in the Velasta. The DP1, the prostaglandins receptor, is one that's usually associated with ovarian or some of the female cancers. Says I'm 6 months post Lupron after being on it for a year. PSA is stable at 0 to 0.02. Testosterone is at 325, up from a low of 7 and rising. I'm concerned about the possible recurrence with rising testosterone. I weigh 180 pounds. What would you recommend as a preventative dosage? Just because your testosterone is raising does not necessarily imply that you're feeding the cancer. There's several programs going on right now with the fact that, for example, on HER2 positives, which we're going to get into, and some of the hormone-driven cancers, is it really the hormones that's driving the cancer, or is the cancer itself producing a lot more of those hormones? So we want to look at that pretty carefully and see the basic cause and effect as to what's really going on there. As far as a recommended preventative dosage, you weigh 180 pounds, you're looking at, if you had cancer, it would be 1 milligram per kilogram. So you're running about 100 kilograms there, a little less, about 0.8. And so you're looking at somewhere between 50 and 80 milligrams a day at your weight level as a maintenance level. He also writes, for a 110-pound, 85-year-old woman with early-stage Parkinson's, what is recommended dosage to combat hand tremors, and how soon should I expect to see a reduction in the tremors? On Parkinson's, we've had quite a bit of success. So on a 110-pound lady, I would start her out at about 100 milligrams a day until her tremors go away. And then you can reduce it. With Parkinson's, we find that early on, you're better off to go with a relatively high dose, get the tremors under control, and then slowly wean back the dosage. Desiree writes, do you know if Velasta works for both metastatic cancer, HER2, triple negative? Does it matter what type of breast cancer it is for the Velasta to be effective? There's a couple things here. These cancers, there's two mechanisms of kill that we've so far identified with the Velasta. The first one is the inhibition of the PD-L1 or the tyrosine N group of that receptor. The other one that we've looked at, which is independent of the PD-L1, it has more to do with the glucose receptors on the cancer cells, which there's thousands of times more on a cancer cell than there is on a normal cell. When the glucosidic astaxanthin makes entry into the cell through the glucose channel, then it doesn't matter what kind of cancer it is. When that astaxanthin donates its electron to the hydroxyl free radical, which is a conjugate acid, but when it donates it to that free radical, the pH inside the cancer cell changes dramatically, increases well over 10, and kills the cancer cell very, very quickly. In some cases, and we're seeing this more and more, that the kill happens so quickly you can actually gum up the works, which means that the necrotic tissue that results from those dead cells can put some pressure on the lymphatic system in getting rid of that material. So we can take away the lethality or the terminal condition very, very quickly, but cleaning up the dead bodies on the battlefield are sometimes takes a little longer and can cause some of the inflammatory responses we're seeing in the lymphatic system. Yuri writes, what supplements or remedies would you recommend for increasing the number of white blood cells while taking Velasta? In particular, what do you think about Avemar, which is certified as a dietary supplement? Would it be beneficial or counterproductive? Avemar is an effective dietary supplement. What else can be done for increasing the number of white blood cells? Avemar is a supplement that does a number of things, but it has been looked at by the NIH. It does seem to help with glucose metabolism, which can be helpful in the autoimmune deficiency side. It was originally developed, I think, for animals. He addresses it here a little bit. Animal patients battling cancer and autoimmune deficiencies. The white blood cell count can go up with the use of Avemar. There's no contraindications with Avemar versus Velasta. From the information that I've seen so far, it could work as a complement. I just don't have enough information or statistical or strong quality control to know where the Avemar is coming from and its overall concentration and effectiveness. But it's something that everybody should probably try if they're having a problem with white blood cells. Chemo obviously drops the white blood cells. Neutropenia is typically the name, I believe, of the disease where the white blood cells usually results from chemo treatment, viral attack, bacterial attack can actually force an increase in white blood cells. But to get it back is a nutritional issue, and making sure that your bone marrow and your spleen are operating properly. In autoimmune diseases, this can be a problem, but your doctor has some prescription medications that can get white blood cells counts back up if your bone marrow is still intact. Melina, I've had visceral adipose fat for 20 years and I'm now postmenopausal. I have a high metabolism and have never had to diet. No, God bless you. I am probably too thin except for my waistline. I'm 5'6", weigh 125 pounds. My waistline measures 35 inches at my belly button. I have had no success in losing fat there, which is not only unattractive but unhealthy. Will Velasta have any effect on this type of fat? Two things here. It will have a very positive effect on it. And let me explain why that is the case. Some of it's dietary. You need to take adipose fat originates typically from sugar consumption. And again, we're back to fructose. Fructose is converted into these types of fat cells, and they're deposited there. I don't know what your cholesterol is running, but all fructose needs to be taken out of your diet. All sugar needs to be taken out of your diet. And once those cells are there, it's very, very difficult to get them to totally go away. You can shrink them in size by staying off of sugar, off of fructose, and keeping your cholesterol in check. The Velasta helps by reducing the insulin resistance that usually results from high fructose intake, that then results in the adipose fat deposits. So it's definitely worth a shot. You'll know very, very quickly. Within about 3 weeks, you may see some effect in your blood work. But right now, if you're eating, you've never had to diet, it's probably in your diet as to why that fat is being deposited. So remove all sodas, anything containing high fructose corn syrup, no honey, no sugar, and see if you, first of all, can't be gaining weight. And I would hope that that would be the case. You're going to be able to eat more meat and potatoes and vegetables, and those typically are not going to end up being deposited as adipose fat. Thomas writes, I have contracted shingles. We've been using Velasta for about 2 years. Does Velasta help with shingles healing? Anytime you get a viral, which is what shingles is, it's promulgated from a virus that lives in the spinal fluid in your back. You have it for the rest of your life, typically from chickenpox or the cytomegalovirus. These, whenever you get a virus infection, the viruses never really leave your body. They live in the neurological fluids, and once your immune system breaks down, then these viruses will express themselves and present usually as shingles. They can present as other illnesses too. But the inflammation caused by these viruses is mitigated quite a bit by Velasta. So if you're on Velasta, the outbreak of shingles, although it can't stop that occurrence, it can stop the pain associated with it or reduce it dramatically so that you don't have such a discomfort during that period. Chadley writes, I love the AskSam Q A. I love Velasta. I wish everyone would be taking this stuff, especially cancer patients. My wife was diagnosed with stage 4 HER2 positive breast cancer with mets to the brain, liver, lungs last year. She is now on Enhertu, which is an incredible drug. This is an amazing drug. I'm curious if the awesome folks at Velasta have looked into drugs that are like Enhertu that attach to the HER2 hairs. Enhertu has 8 molecules of chemo instead of the previous 4. Velasta, as I understand it, will turn off the blocking that comes from HER2. These two incredible things combined would be the Chuck Norris of cancer treatment. Enhertu going in with an offensive attack, and the Velasta enabling the body to also go in with a natural offense. Then, of course, defensive mechanisms to other cells. As you've gone through a family of trastuzumabs, Herceptin, I'm curious if on one of your sessions you could go into the depth of the topic of Enhertu, deruxtecan, and type drugs that are newly coming out. He goes on and he talks about some other things there. Enhertu is a Herceptin type molecule. They're making some real good advancements with Herceptin, along with the some of the other chemo drugs. Deruxtecan is one of those that the Herceptin allows for the opening up of the cancer cell, and then the chemo drug goes in and initiates the kill. It is truly like studying in a war college and some of the texts associated with how do you attack a target. We are now at the biochemical level where we're applying those same principles. And this Enhertu is one of those amazing combo drugs. The good news is they're two separate offensive attacks. So there's two flanking maneuvers here. The one coming from the Herceptin with the chemo, and the other one with the Velasta. And we're seeing a synergistic effect here that is has truly caught me a little off guard in some of the responses that we're getting with people who are using the Herceptin along with the Velasta. The kills are pretty amazing. And then he has, as a side note, the drugs seem to be working. My wife has had 2 previous scans showing great news. She has 1 large tumor in her cerebellum. Cancer specialists have already said they will monitor closely, but they believe it's necrosis. They do not know for sure, but do not want to go to surgery just quite yet. The scans showed also a milky or silty look, cloudy around the hull. Yeah, the cancer is probably dead. I have a very high probability in saying that. The cancer, these types of drugs, and we don't know the resistance capacity of the cancer, whether it can become resistant to Herceptin or not. There's one coming out of Sloan Kettering that is just amazing. It's part of the PD-L1 that we've been promoting now for about 4 years. They finally have recognized Dr. Addison's work and the ability to go in and put in PD-L1 inhibitors. It's very similar to what Velasta does. The difference is that drug is about $11,000 a dose. So that's a little bit of an economic problem, whereas Velasta probably would do the same thing at a much lower cost level. But both together would have a tremendous synergistic effect. I don't think the cancer could prevail once it's under that kind of attack. Daniel writes, I know you're not a fan of vitamin C. Can we replace the vitamin C with Velasta and also take the proline, lysine, amino acids at the same time? Do you think Velasta would even have a better effect in decreasing plaque and lowering lipo than taking high oral doses of vitamin C? Will the Velasta also increase protein collagen production? If you have a high calcium score, do you think Velasta? Okay, I'm not a, I understand what vitamin C does. And vitamin C is something that our body needs, but not in excess. Nowadays, in our green peppers, red peppers, most of our vegetables, we get plenty of vitamin C. to meet our metabolic requirements for vitamin C. You don't hear many people getting scurvy anymore. So, but that's not the issue. The issue is if you want to resolve your inflammatory disease state, Velasta is 6,000 times more potent than vitamin C. So I can't recommend taking vitamin C as an anti-inflammatory, although that is some of the advantages of it, but it's very, very low compared to the radical attack compared to Velasta. The proline and lysine amino acids are very interesting amino acids. Lysine, for example, is needed to make glutathione, but if you don't have the molecular manufacturing capacity in the mitochondria, and you can't convert the lysine amino acid into glutathione, then taking more lysine is not going to be an advantage. Simply taking something and assuming that it's getting into your body is a bad assumption. There's, for example, just to process glucose, there's 27 different steps. If any one of those is not functioning, it doesn't make any difference how much glucose you have in your body. You can't get it to the energy level. So lysine and proline are the same way. Simply taking them and making them available does not mean that they're going to be effective. So you have to look at your overall health and making sure that you still have those processes in place. As we age, our ability to convert lysine into glutathione goes away. So in that case, and you can't take glutathione because it gets destroyed by your stomach acid. High doses of vitamin C via IV, for example, I'm not a big proponent of it, simply because it raises very high concentration of vitamin C in your bloodstream, puts undue pressure on your liver, and can result very quickly in fatty liver disease. Unlike taking it orally, your body's going to absorb whatever it can absorb in the small bowel. But there are people who believe that taking very high doses of vitamin C, it's not needed. You only have to take 1/6000th of the dose of Velasta to get the anti-inflammatory effects that you get from IV infusions. If you have a high calcium score, do you think Velasta can lower the score? Velasta is, you have to understand what's causing the high calcium score. Typically, calcium score in the bloodstream means that there's two ways that it happens. The first one is you're not removing it from your bloodstream as it concentrates in your bloodstream, and or you're losing bone mass, like in osteoarthritis or prostate cancers, ovarian cancers, where you now have lytic lesions forming in your bones, and that bone is being dissolved, and it shows up as a high, typically a calcium score or an alkaline phosphatase score. So alkaline phosphatase in your comprehensive medical or metabolic panel should be followed very carefully. Make sure that number is always below 120. If it gets above 120, it means you're losing bone mass to something. It could be inflammatory, it could be cancer, it could be whatever's causing your bones to dissolve. Again, I know you're not positive on vitamin C, primarily because it can cause liver inflammation. However, at high doses greater than 15 grams, vitamin C becomes pro-oxidant versus being an antioxidant at lower doses. As you know, cancer hates oxygen and does not thrive well in the environment. So why not use both high-dose IV vitamin C and stop taking the Velasta on the day of the IV? This you are getting, okay. Understand very carefully what pro-oxidative means. Pro-oxidative means that it's going to generate free radicals. And it is something that you want to look at very, very carefully, that during the processing of vitamin C in the liver, the inflammatory response that you get is caused by the generation of that metabolic process of processing vitamin C. So anything that generates free radicals is not good. We die because we are oxidized. Not to get off on another subject here, but everybody thinks that CO2 is the primary problem in our atmosphere for climate change. Well, nobody dies from carbon dioxide in the atmosphere, but everybody dies from oxygen in our atmosphere. Oxygen is a poison, the same as fructose is a poison, but we have the ability to use oxygen in our metabolic processes. Unfortunately, the result of that in our mitochondria is a generation of oxidative species that are so reactive that they cause damage and cause us to die. So I'm not aware of anybody who has died from a chemical inflammatory response from CO2 in the atmosphere, but everybody dies at some point in their life that die from an inflammatory disease caused by reactive oxygen species. Anything that is a prooxidant or generates a prooxidant during its metabolic process is not good. You're adding to the problem. Antioxidants, on the other hand, can mitigate that generation of those reactive oxygen species and keep them pushed down, more tempered. And that's what extends our life. And typically we have the ability to manage that. Our bodies are very good at managing oxidative stress. But we do reach a point where we can overwhelm it. And that's something everyone needs to be concerned about. Do you think there would be a greater benefit if Velasta can also come as a suppository? By using the rectal route, you're even getting a higher bioavailable dosage. In addition, if you have prostate cancer, this may be an even better way of taking Velasta. What do you think? I've not done any work on using Velasta as a suppository. Most of these are going to be absorbed through the small bowel, not through the rectum. The rectum is, or the colon, is very good at pulling moisture, not so much oils. So I don't know if it would be that readily absorbed colorectally or not. How would you compare Lutein, Zeaxanthine combination to Velasta for macular degeneration? Lutein and all of the xanthophiles are very, very good at free radical scavenging. The macular degeneration is an inflammatory disease. We're seeing tremendous results and in some cases reversal of macular degeneration where the macula reattaches to the back of the eye. So these are all good. They all fit in a category of what's called ORAC scoring, and these are also can be prooxidants. At this point, the photophiles, the xanthophiles have varying degrees of being prooxidants when they're processed. Astaxanthin is the only one that we know of at this point that is not a prooxidant when it's metabolized in the body. Erica writes, I'm Erica, a 56-year-old female diagnosed with triple negative breast cancer. Genetic testing was done, and I have a PMS2 mutation, Lynch syndrome. I had lumpectomy August the 6th to remove the mass, removed 2 of my lymph nodes, which were clear. I refused chemo and radiation, and was NED in October 2020. July 2021, I found lump under arm where they removed the lump. I had ultrasound but refused biopsy, worried they would spread again. Started seeing an integrative doctor and doing treatments. We are checking my Nagalase, which was lowering. However, in February 2022, a new oncologist ordered a PET scan and it showed cancer hadn't spread anywhere, but the mass had taken up all the room. Okay. I found Velasta, immediately started 12 drops a day, May the 18th. My CRP is 4.1. I've used the salve about 10 times, painful for me. Living on THC, CBD for pain. Since using Velasta, mass seems to be shrinking, but I have developed this boil or cyst looking thing on it. I will attach a picture. It has begun to leak white fluid and has a tiny bit of skin flaking off. Is this the die-off you spoke of? I have also started getting pockets of fluid under my ribs in the back, thinking this is drainage. Can you let me know what you think it all may be? This is very typical. Once the cancer dies, and we've spoken about this quite frequently, the body will build a cyst around it. It's foreign matter, and it will typically be pushed out. The white blood cells and the macrophages and lymphocytes will push that thing right out through your skin, and it'll erupt. First, it'll get very red, it'll get sore, and then it'll burst open. And the guts of that cyst, of that necrotic tissue, will flow out. Only then will it heal up, and whatever was in there is gone. The drainage that you're seeing, a lot of it's edema, but when you have these kinds of debris fields, pollution inside the body, they don't belong there. The body knows they don't belong there. So what happens is the solution to pollution is dilution. So our body, when it sees something like this, will try to dilute the problem away, try to thin it out so it can be picked up, degraded, and either pushed through the kidneys or pushed out through the fecal route. If the material is too thick, there's too many cells there, it looks like a thick plastic or gel. There's not enough fluid. The body will keep pumping fluid in, and that fluid will start to accumulate in interstitial areas within the body. Either it can be in the pericardial area if it's around the lungs. It can be in the rib cage, around the organs. And sometimes that fluid has to be mechanically drawn off to get ahead of the game. And they'll pull that material off, and then it will keep decreasing as the body no longer has to pump fluid in to dilute the problem away. Hope that answered the question. I'm 5'3", 120 pounds. I want to drink the whole bottle. No, don't do that. That'll put you into bankruptcy. I just ordered 2 more bottles. What's the most Velasta I can take in a day? I'm trying 18 drops now. I'm hoping it will help with pain and speed up the process. We've been as high as 3,000 milligrams per day. 3,000 milligrams at 13.5. You're gonna have to check my math here. So in a 100 ml bottle, that'll last you about 2 days. So it's probably not necessary. It's not something that we would recommend at this point. There is something to be said for those who are in severe cases. For example, those who are stage 4, 2 to 4 months, 3 to 6 months, maybe less than a year of survival, it's okay to go up very, very high in dose and use what's called the concentration gradient to push more into your cells than what could be normally absorbed. So there is some protocol that would allow for a much higher dose. There's no downside to it. It's just an economic decision as to how much you would pass via your stool. Okay, let's see what we got here. I'm currently having chemo and immunotherapy. Doc does not want me to have any antioxidants because they may interfere with the efficacy of the chemo destroying cancer cells. I've developed several side effects to the chemo. Okay, when you take chemo, you generate an inflammatory response. You're going opposite from a disease state. The idea is that the chemo will be so aggressive and so inflammatory that even the cancer cell cannot survive the inflammatory attack, the chemo attack. But it does cause a huge inflammatory response. That's why people get sick. Now, the Velasta, being an antioxidant, will have a tendency to moderate the effect that chemo is trying to promote. So they can be either or. You know, if you hit it with chemo at this point here, the Velasta will, as you increase the Velasta, the effects of chemo will slightly decrease because there is some neutralization of it. But they are different protocols, and what really does a lot of the damage is not directly, long-term damage is not directly the chemo, it's the inflammatory response to the chemo. So if we can mitigate that inflammatory response, let the chemo drug go in and kill the cancer cells, but moderate the inflammatory response so that your 5-year window of remission or representation of the cancer, we don't have that. We want to manage that so you never get cancer again. Chemo only deals with the symptoms of it at that point. There's not many oncologists who talk in terms of cure at all. But if we can get back to what's causing the cancer, we are now on the verge of being able to say that we can cure cancer. And that's a place we've not been before. Ami writes, my son who has histamine mast cell issues which affects his digestion, causing nausea, reflux, appetite, and weight loss. In April, he slowly worked himself up to 6 pumps per day. I became concerned right away as I felt like he was losing weight. He did, and it seems the Velasta has helped his overall histamine issues. However, he looks completely emaciated, has little appetite, and looks to not be absorbing much nutrition. After watching your last video, I became a little upset as you talked about anticipating weight loss. I do not want to stop the Velasta, but he also cannot afford to lose another pound. Hoping you can advise on what to do. We have backed off to 4 pumps per day, but it hasn't made a difference. Also, several of my family members are taking it. Some of us are very lethargic. Some have more energy. Please explain. Each individual is going to be slightly different. But typically, it's not the Velasta that's doing this. It's a lack of nutrition. His appetite, hopefully he's not reaching a point, because even in starvation, you reach a point where you no longer are hungry. So he needs to address the fact that he needs to eat 4 meals a day, a minimum of 2,000 calories per day, whether he wants to or not. Eventually, his body will get to the point where he'll get his appetite back as the demand and as more cells begin to take over. The weight loss issues is typically when you consume food, it is supposed to spark an insulin reaction. So, and we see this in type 2 diabetics, they end up losing weight because what typically happens with type 2 diabetics is they eat, the sugar can't be consumed by the cells because of insulin resistance. So what does the body do with that sugar? It converts it into glycogen or into fat that is stored for some later use. That fat is what adds to weight gain. Now, when you go on Velasta, all of a sudden the glucose channels in the cells open up. You begin to consume the sugar that's there based on your current eating habits, but the leptin, the cells are now satisfied with food, whereas when you are insulin resistant, those cells are still starving. Those cells will secrete a protein called leptin to the brain that tells you to eat more. You eat more, your blood sugar levels go up in your bloodstream, but you can't get it into the cell because of the insulin resistance. So the body, through the liver, processes it into fat, begins to store that energy somewhere else in your body, and it adds to weight gain. When you take Velasta, insulin resistance goes away. More and more of that sugar that you've just consumed goes directly into the cell. The cells no longer release leptin. You lose your appetite. You're no longer hungry. So that is what is causing the weight loss. As your body needs nutrition, it will begin to pull it more and more, or your liver will start producing, converting the glycogen into glucose and feeding the cells. So that's what causes the weight loss when you're on it. In your son's case here, Ami, I'd have to look at it very, very carefully to see why he's continuing to lose weight. It probably has nothing to do with the Velasta, but his energy level should be boosting as he gets more and more of the glucose, and his inflammatory disease state is somewhat reduced. I'm curious to see what his C-reactive protein is and see if that number is actually coming down. But a minimum of 2,000 calories a day. You know, if he's a teenager, then that would be ideal. But see if we can't get it turned around and stop the weight loss. Deborah writes, I was DX in 2020 with acute lymphoblastic leukemia, Philadelphia positive chromosome. I did all the many chemos. I was almost 70 then. I've been stable since then. I, though, am left with mushy bones due to all the 100 milligrams of prednisone in those 14 months. I have several spinal disc disorders. Most of my life, I had 2 neck surgeries, second one months before my DX. The one drug, blinatumomab, which is, I think, immunotherapy drug, caused brain issues. I'm not the same person I used to be, mentally speaking. Started Velasta June 19th, taking 4 pumps twice a day, but would you suggest a higher dose of Velasta at 180 pounds? I would go to 12 pumps a day and see if we can't get rid of the brain fog. Will it help my body from all the destruction the prednisone did? Does this help restore nerves, muscles? Can I stop the beta-glucan or anything else I can eliminate, like vitamin C? The vitamin C you could probably cut back a lot on. Keep the beta-glucan going. It takes a while. Once the prednisone, the steroids do the damage on the bones, it takes a long time. It can be months to years for the body to rebuild back the calcium levels that were lost. I would look at you won't be able to build tissue back until your alkaline phosphatase number is pretty much under 100. So you want to watch that on your comprehensive metabolic panel and make sure that you're not losing bone faster than your body can build it. If that's the case, then you're going to end up with a lot more bone issues. So we want to get the bone loss stopped, and the alkaline phosphatase is a pretty good number for showing whether that's slowing down, stopping, reversing. And then at that point, then the body will try to build back. It can be a painful process, but the body will try to build it back. Brianna, is there any evidence that Velasta Astaxanthin helps to eliminate chemotherapy resistance, specifically when cancer cells mutate and use the Wt beta catenin signaling to resist chemotherapy? Okay, I covered that a little bit before. Velasta is an antioxidant. It can eliminate or reduce the free radical progression or accumulation or concentration resulting from a chemotherapy. It typically moderates only the inflammatory response. The chemo itself becomes very effective. And as a matter of what we've observed, the combination of chemo and Velasta have a huge positive effect on reducing symptoms and resulting in a more rapid kill of the cancer, sometimes within 30 days. So that is something that we need to look at very, very carefully. And I have a question here from Shelley. It says, I've listened to all your videos to date, and you mentioned regularly how Velasta destroys a cancer cell. However, how does the Velasta get into the cell if there's a scaffolding around it? This is a very good question. There's what's called an extracellular matrix in some of the more the tougher cancers like pancreatic. In the skull or in brain cancers, we have the skull that acts as a barrier. But in certain cancers, especially cancers that are very well developed and non-detected for a long period of time, and that's the problem with pancreatic cancer, the cancer will build an extracellular matrix, and it truly looks like a molecular scaffolding or net around it. This extracellular matrix makes it very difficult for molecules to get through that into the cancer cell itself. Sugar molecules, being very, very small, have a tendency to go right through it. But very large proteins, sugar molecules are like mosquitoes going through chain link fences. But some of the proteins that we use in chemo drugs are very, very large. They could be 100,000 glucose molecules. It's very difficult for that to get through this matrix. So the cancer can get its food source through the matrix, but it holds back these proteins and macrophages and lymphocytes. They can't get into through this thing to kill the cancer. It turns out that the glucosidic astaxanthin is small enough to penetrate right through it. So from a purely mechanical point of view, as a three-dimensional shaped molecule, glucosidic astaxanthin having a molecular weight of about 600 can actually penetrate through the ECM, the extracellular matrix. But proteins and some chemo drugs that are tens of thousands of molecular weight have a very, very difficult time simply because of the physical size of the molecule. So I hope that explains it. It's all about size and three-dimensional shape. Becky writes, is nebulizing 5 drops of food-grade hydrogen peroxide, 3 millimeters saline solution, 2 drops potassium iodide, 1 times per day for allergies, colds, COVID, creating more free radicals that have to be neutralized. I've been doing this mainly because it helps me stay well and improves my allergies. I also have been taking 6 pumps of Velasta per day for the past month. This is a very interesting question. It goes much deeper than what she's expressed here. Inflammation is a two-edged sword. Inflammation or free radicals are needed to kill bacteria and neutralize viruses. But on a chronic level, you don't want them permeating throughout your metabolism. So if you're spraying this up your nose, I am perfectly fine with that, because these are surface phenomenons. These are allergens. These are bacteria. And those free radicals in your nose will eventually be neutralized. You don't want to do it to the point chronically where you, or in a very high dose, where you're causing inflammation that can result in some sort of nasal cancer or other issue. But I cannot, I'm sort of in the same ballpark as you are here. It's good that you're able to use these as nasal cleaning agents, because the free radicals that you're generating are very good at killing bacteria and viruses. Question number 2, will Velasta help with symptoms of adrenal fatigue like low aldosterone, dizziness, fatigue, lack of energy in the morning, but usually feel more energetic and like myself by mid-afternoon? Also, blood sugar swings, lightheaded, shaky if meals are delayed. Some days I can barely function if I have overdone it the day before or sweated too. Yeah, you got to be more aware of your own body needs. Typically, they're blood sugar related. If you're overdoing it and you've used up the glucose in your body, you're going to get very low blood sugars, and that's going to cause exactly what these symptoms that you've just expressed here. You've got to look at your nutrition. Dr. Fred Bishy's book describes how to manage that, but vegetables, protein are all good ways of managing this. Blood sugar swings are not good. They're going to take you into areas of being totally out of control. You need to moderate it. Sugar is the worst thing you can do. Drink plenty of water and stay hydrated. That's another very, very important thing. But Becky, it sounds like it's nutrition more than anything else. Yuri writes, I was diagnosed in July of 2019, stage 4 prostate cancer with mets of the bones and lymph nodes. I'm taking 14 pumps of Velasta per day since January 1st, 2022. I'm also taking Orgovax hormonal pills, but ran out of them 20 days ago. My recent blood test showed CRP at 2.4, alkaline phosphatase 98, PSA 14.5. It was 2.7 2 months ago. Question, what exactly is raising the PSA? May indicate my case. Should I order more Orgovax or increase the dose of Velasta? How can I interpret my CRP, alkaline phosphatase numbers? Any specific diet, food exclusion, supplements? For the last 10 weeks, I began experiencing increasing lingering pains in my muscles, bones, joints. Is it a positive or a negative sign? I'm going to take question number 1 first. Why is this PSA going up? Some of it can be hydration, some of it can be timing. Sex, for example, within 3 days of getting your PSA will dramatically raise your PSA number. So make sure that you've abstained from sex for at least 3 days prior to getting your PSA. Stay well hydrated. Your alkaline phosphatase number, which is 98, which is okay. I'd like to look at the trend of that. The C-reactive protein of 2.4, I'd like for that number to be a little bit lower, and I'm going to address that here in just a minute. Any specific food exclusions? Again, keep the fructose and the alcohol out of your body. Keep sugar out of your diet. And see what it does to that number. It's the trends that I would have more interest in following. Your PSA jumping from 2.7 2 months ago to 14.5 is of concern. Your Gleason score, if you had one of those, it's directly related to appears to be related to PD-L1 expression if it is cancer. So we would definitely want to look at that. A trend in 2 months of 2.7 to 14.5 could be a false positive. It could be prostatitis. It could be hormones or a lack thereof, and your prostate is irritated because of the hormonal fluctuations. So we would just want to follow this at this point and see how it goes. With that, I'm going to close for now, and keep your questions coming in. I'm extremely pleased with the quality of these questions and the interest and the awareness that people are now taking in their own health. So from a diet perspective, cut out fructose. Get exercise, go take a walk, and keep taking Velasta. And stay tuned, and please keep sending in your questions. Thank you very much.